What role does patient education play in long-term outcomes, and how do you ensure that your team is consistently educating and not just adjusting?
One of the unique things about our practice is we have a doctor-patient relationship and a doctor-patient visit every single time you come in the door. And so what that means is it's not just a lay down on the table, we do a 1 minute adjustment and you're out the door. That's a different style of practice. We have individual treatment rooms. We close the door. We have one-on-one with the doctor and the patient. And what that means is there's a period of time there. It's not an hour every single visit. I'm not going to pretend that. But you do have somewhere between 10 and 15 minutes, 7 to 10 minutes, whatever that may be for that visit, where you're having a conversation with the patient every single time they come in. And over the course of a treatment plan, if somebody has to be in here because they have a severe issue 3 times a week for 4 weeks, you're talking about quite a bit of amount of time that you can impact that person and ultimately help them learn what the human body is all about. And for us, again, we are providing an adjustment, but that's external. That's us doing something to your body. Long-term overall health is something you have to do for yourself. And, I go back to my routine. Nobody's telling me to get out of bed and go run at this point. Nobody's telling me to eat right. And it's decisions that I've made because of the information I've accumulated and the lifestyle I've chosen to live that I'm intrinsically, internally motivated at this point. And that's what we're trying to do for our patients is we're trying to give them the information, the knowledge in order to allow them to live just function optimally. And hopefully they will slowly implement some of these strategies so that they can take care of themselves and they're not reliant on either, regular, acute care 3 times a week for 4 weeks, or whether they're not relying on a medication to be healthy, or they're having to see 5 and 7 different doctors for all these issues that they've developed over years. We're trying to give them the knowledge to take care of their body, to ultimately live active, pain-free, healthy lives that they desire.